The first 2 weeks after a knee replacement decide a lot. And the biggest mistakes I see aren't medical. They're not surgical complications. They're actually things smart, motivated people do to themselves with the best intentions. Here's the honest truth about those 2 weeks. They can fool you. They can fool you into doing too much. They can fool you into doing too little. So let me walk you through the mistakes I see patients make again and again and how to sidestep every one of them. Get these right and the whole recovery gets easier because these 2 weeks set the tone for everything that follows. What you do now, you feel for the next month. The first mistake is the most common one, doing too much too fast. And I get why it happens. The pain control we now use is really good. For a knee, we use an adductor canal block, an iPACK block, plus we put some numbing medicine around the joint at the time of surgery. That medicine can give you a couple of really comfortable days right out of the gate. Call it a honeymoon. The blocks, they work. The swelling hasn't shown up yet, and you feel great. Maybe too great. Let me tell you about one gentleman. He called me about 48 hours after his knee replacement. He was out in the yard trimming his bushes. He was thrilled with himself. But here's the problem. I knew it was a setup. Because at 48 hours, the swelling hasn't really arrived yet. It settles in around days 3, 4, 5, and 6. That's when the tightness and the soreness really show up. And if you spend your good days overdoing it, you'll meet that swelling at a much worse place. So when you feel great early, that's not a cue to attack it. That's your cue to pace yourself. Think about what's really happening under the skin. Your body is healing a big operation, and swelling and inflammation build up over those first several days. They don't peak at day 1. The blocks are buying you that quiet window before all of that swelling arrives. So use that window to rest and set up, not to test how much the knee can take. A boring, gentle first few days buys you a smoother first few weeks. The second mistake isn't something you do, it's something you expect. There's a lot of marketing around knee replacement now, and it leaves people with this picture in their head that at a week, they'll be perfect. I'll be honest, that one really bothers me because it sets you up to feel like you're failing when you're actually right on track. You're not going to get your full recovery on day 1 or week 1. It's a process. We have great techniques to control your pain and they work. But once those nerve blocks wear off and the swelling settles in, it gets harder before it gets easier. The toughest stretch is usually right around days 3, 4, 5, 6. That's not a setback. That's a normal shape of this thing. So don't measure your week 2 against an advertisement. Measure it against the truth. Steady, real progress with a hard stretch in the middle. And let me give you the real yardstick. Here's roughly what a normal 2 weeks looks like. The day of surgery, you're up and walking, and you'll take a few stairs, and then we'll let you go home. The first day or 2 can feel deceptively good. Days 3 to 6 are the hard stretch, more swelling, more stiffness. Then, somewhere in the second week, most people are trading the walker for a cane. You're moving a little better. The swelling starts to settle. You're still sore, still swollen, still working at it, and that's completely normal at week 2. If your week looks like that, you're not behind, you're right on schedule. That leads straight in to the third mistake, getting discouraged. Here's how it goes. The first couple of days feel good, then the blocks fade, then the swelling shows up. Now you're leaning more on Tylenol, anti-inflammatories, and maybe some stronger pain medicine for a little while. And the knee just feels worse than it did on day 1. A lot of people hit that moment and they think something went wrong. Almost nobody did anything wrong, and there's probably nothing wrong. This is the part of the road I tell people to expect. It's a dip, not a detour. The mistake is letting that dip talk you into quitting your plan, skipping your motion, sitting still, giving up. Don't do that. Keep doing the small, steady things and use the tools you were given. Take the pain medicine you were prescribed on schedule on those hard days, especially before therapy. Don't wait until the pain is on top of you or has overtaken you to start taking the pain medicine. It's harder to chase the pain than it is to treat it. Then, as the swelling settles, you ease off the stronger medicine and you lean on the simple stuff. That's the normal arc, and your team will guide it. Because the people who push gently through those days, 3 to 6, they're the ones climbing back up by week 2 and 3. Now, the fourth mistake is the opposite problem, doing too little. Some people get so worried about the new knee that they baby it. They sit still. They skip the gentle motion. They're scared that putting weight on it will hurt it in some way. So let me settle that. You can put your full weight on your new knee right away. The walker and the cane, those are for your balance, not because the knee can't hold you up. You're up and walking the same day of surgery, and gentle, regular motion is part of what gets you better. This is also where icing and elevation earn their keep. Keep that leg up. Keep the cold on it with a barrier so you don't hurt the skin. A lot of patients use those cold therapy machines just to make the icing part a little bit easier. And controlling the swelling is one of the few things that's actually been shown to help in those early weeks. Less swelling means a knee that moves easier and hurts less. Motion is life, and a little motion every day within reason is the goal. Pick a couple of simple things to do and do them often so you can track your progress on those simple things. They'll add up. And don't skip your therapy just because you're sore. Sore is expected. Your physical therapist knows how to work with a swollen early knee, and that's the whole point. Showing up, even on the rough days, is how the motion comes back. So the target isn't do nothing, and it isn't do everything. It's start slow, almost insultingly slow at times, and build a little at a time. The last mistake is the most important one to avoid. Staying quiet when something's actually wrong. Now, I just spent 5 minutes telling you that the day 3 to 6 dip is normal, and it is. But there are a few things that are not part of the normal dip, and they deserve a phone call, not a wait and see. A calf that's red, swollen, or painful. A fever, and I use a temperature greater than 101.5 as my index. Drainage from your incision, or pain that suddenly gets far worse instead of slowly better. Don't tough these out. Don't talk yourself into not calling. I know the instinct. You don't want to bother anybody. You've been told the hard days are normal, so you assume this is just more of that. But these few signs are different. A blood clot, an infection, a wound problem, those are things that we catch early and can handle easily. You need to call. You're never bothering us by checking. That phone call is part of your recovery plan, not a complication of it. We would rather hear from you and tell you everything's fine than to have you sit at home worried or even worse. Knowing the difference between the normal dip and a real warning sign, that's one of the most valuable things you can take into these first 2 weeks. So here's the whole thing in one breath. The first 2 weeks will fool you in both directions. Don't let a great first day talk you into doing too much. Don't let days 3, 4, 5, 6 and the predictable dip talk you into doing too little. Don't measure yourself against some ad that promised perfect in a week. Keep moving gently, ice and elevate, and call us about those few things that really do deserve a call. If you're concerned, we're concerned. Start slow and build, and give yourself the grace to have a few hard days in the middle. That's not failure. That's the process working exactly the way it's supposed to. This is a process, and you're going to do great. If you want to walk through your own recovery, there's a link to schedule a consultation in the description, along with my full first 2 weeks recovery guide. Thanks for watching. I hope you'll share your questions below. Until next time.